Always when you have something to do.
Okay, Madam President, everyone who's on, we are officially live on Facebook. So if you want to take over, Madam President.
Well, hello, everyone. My name is Sheila Weber, and thank you for joining NB&PA this evening. So let's talk. Hello, everyone. My name is Sheila Weber. Let's talk about it. Isolation, depression, suicide, mass shootings, and Columbine, Sandy Hook, Douglas High School, and most recently, Robb Elementary in our very own state of Texas. Our moderator for tonight's topic, mental health awareness, is Crystal Thibodeau. Crystal?
Hi, good evening, everyone. We appreciate you all joining us on this evening. The organization felt fit to end Mental Health Awareness Month with having an open discussion about the stigma of mental health and also the recent suicide stories that we have come across since the beginning of the year. We have two dynamic speakers. They had the pleasure of speaking for our third annual educational conference on last month, and their topics were quite similar to what we will be discussing on tonight. So we appreciate them both very much for agreeing to speak tonight. A few housekeeping rules for tonight. I will introduce both speakers, and after each speaker, we will address any questions that anyone may have in the chat. Once we address the questions in the chat, the next speaker will then speak. And at the end of the presentations, we will have an open discussion if anyone wants to discuss their personal experiences with mental health or dealing with someone you know with mental health, family members, as well as if there's any providers that is on the call discussing your personal experience in the workplace with patients with mental health, and basically how we can end the stigma more so in the African-American community. So before we get started, would like the board members to introduce themselves.
Unmute yourself, Madam President.
Oh, Ms. Sheila.
I'm sorry, I didn't realize I was muted, guys. I apologize. My name is Sheila Weber, and I serve as president.
I'm Crystal Thibodeau. I serve as vice president.
Latricia Harrison. I am executive board member and founder.
Sorry, my camera's not coming on, but I'm Stephanie Brown. I'm also executive board member and co-founder.
And before I introduce the first speaker, as Ms. Sheila mentioned, with the recent incidents with the school shooting or what have you, we do want to keep the family and teachers in prayer for the recent tragedy. They did announce as well on today that the husband of one of the teachers that had died, he also passed away today due to a heart attack shortly after visiting the memorial that was formed in front of the school. So we definitely want to keep everyone in prayer at this time. So I will introduce our first speaker, which is Ms. Sagan Allen Williams. Mrs. Sagan is a native of Eunice, Louisiana, and currently resides in Gonzales, Louisiana. She is a licensed professional counselor and supervisor with nearly 15 years of experience in mental health services, clinical supervision, and program management. She currently serves within the Learning Development and Performance Department at Aetna CVS as a training program owner, and she is dually certified as an adult and youth mental health first aid instructor. Sagan also serves as a culture champion within the Aetna CVS organization, where she has the ability to drive the social equity, diversity, and inclusion initiatives. Lastly, she is the owner of her training and consultation firm, For Great Minds, and creator and host of the web show podcast, The Gumbo. Sagan is a mother of 3 children and a wife of her #1 cheerleader and supporter, Mr. Glenn Williams. Sagan admires the versatility of her work and roles, the ability to teach, inspire leadership, and champion diversity, all while spreading joy, is what Sagan deems to be her life's contribution. We welcome Mrs. Sagan Williams.
Thank you, Dr. Thibodeau. Good evening, everyone on the call. First of all, thank you all for having me. I am humbled by the invite, as I was with the conference as well, which I also enjoyed. So just thank you for showing up and all of what you do and contribute to your community. I will say this, I have to be as transparent as I possibly can, and I love the informality of the talk, because what I didn't want to do was present. And I say that because I'm so used and accustomed to teaching that if it was a slideshow and just telling you what mental health is and what suicide is, then we're not attacking or even contributing to the conversation of how to approach action, rather, or how can we find a feasible plan to make sure that some of these mental health issues don't exacerbate like they have already. I'd be remiss if I didn't mention how this week has affected me as not only a counselor supervisor, but a mother. That something that I don't even take a second thought of dropping my children off to school. I expect to pick them back up. And that is something that, again, that I could be grateful for, but also something that I did take for granted. So I think our recent events have shown us that mental health will show up anywhere in all of us. And if you're an empath or even have some sort of humanity, then it has affected you as well. I think we can all agree on the call. What I did say is that I was going to make some points, because between last night and today, it's amazing how I got, I guess, downloaded information of historically, how did we tackle mental health? So the history of mental health, we often don't talk about. And when I say we, I'm mentioning more of myself. I'm internalizing this. Historically, mental health was treated as an abnormality of the brain. Okay, it's a phenomena. Long ago in the 1800s, they didn't know what to call mental health. So typically it was treated in asylums, right? Money, tax money, all of our dollars went towards asylums. These persons were shunned away from community and treated in these asylums. And I say treated, and I use it very loosely. They were tortured. They were studied. They were pumped with insulin at times. There was electroconvulsive therapy that was done behind these walls. And I don't think we oftentimes remember, just go back and think, oh, the 1800s. Mental health is not something that just came about. It is something that has been, and it has always been misunderstood. And I think if we take that into consideration, then we can accept the fact that we still don't understand it. And we don't know what part of the body it tackles, all of the warning signs, how to stop it. But if we can definitely take and adhere and acknowledge our limitations in that, then I think that that's the best way to start. I'm a licensed counselor and I don't have the answers. I don't know if anyone else could put that in the chat or say that to yourself on the call, that you are a licensed or doctorate level professional and you don't have all the answers. That's a very humbling statement, Because what that does is saying, not that you're not competent in dealing with this disease, not that you won't see patients and clients that come through your front door that rely on you to be the expert, but it also will see yourself as a human, that you have to go home and know that even someone had mentioned on the call, having a suicidal patient at the end of your day is something that you still have to take home with you. We are human. We do not have the answers. So I think that if we take into consideration the history of what mental health was, how it was treated, it's an anomaly still. It's a phenomena we still haven't been able to even touch the core of what it is. We were never equipped to treat it here and here on in the US especially. We are the only country that is dealing with massacres. And I was looking at this as like, okay, how are our other countries dealing with mental health? Should we lean in and maybe ask them to join in on the conversations that we're also having as well? Because our communities, even if we marginalize this to just African Americans, they're dealing with a whole different, it's a different ball game here, things we don't get to talk about. So I have to say, signs are important, very important. I won't be dismissive of all of the good information that we provide. Signs are very important. But every time I get on the news, I see and hear that there were signs that we ignored. Most recently, the young man had signs, very quiet, withdrawn, didn't talk very much, went out for his 18th birthday with his grandmother. They went to Applebee's. They probably noticed several things over the course of the time that he was talking about it. Past students, friends, they would say that he acted oddly, oftentimes threatening others, oftentimes threatening that he would do something to this extreme. Are our police and law enforcement equipped to handle mental health? They saw that he crashed the car and vehicle. They didn't know where he was going. Are they equipped to intervene? So if we're going to start digging into the surface of mental health, where's the root? Because all of us from the bottom up have to be equipped to deal with something like this. Do we have the services and access in place? Not all the time. So I'm speaking for myself that as much as I know, I still have to learn. The signs and symptoms are there. Am I asking the right questions? If my child, my family, so on and so forth, being withdrawn, not interacting with certain activities that you're accustomed to, doing more of something that is not so healthy for you, drinking, eating, sleeping, those signs again might be correlated with something else, another disorder or comorbidity you may have. You may be a diabetic and maybe feel more fatigued, but is this out of your norm? Are we asking the right question? If we're asking the right questions, are we protecting the wrong people? And I say that because our family members could very well have signs and symptoms that scare us. But do we tackle those things? Are we sitting there, just as the grandfather was interviewed, mentioned that he saw these things, but were you going to report it? That he had access to weapons? Are you truly going to cross that threshold between your family now that you have to do something of this, even though you know something's wrong? So what are we protecting ourselves from? So I'm preaching tonight in a sense of just the fact that I've internalized this tragedy, all of the tragedies that we've had in the past month. It's ironic, the month of May, that this is not the only time we should be talking about it. We should accept our limitations. We should say to therapy or not to therapy. And while we're not using therapy as a preventative care, we should also talk about that. As soon as you feel stressed at work, why don't you talk to someone? As soon as you see these signs and symptoms, why do we ignore it? So if we aren't asking ourselves those questions, then I don't think that we would ever figure out mental health or being able to properly treat it. I'll close in saying this. I told myself that I don't even feel equipped to even speak to you all this evening, because I don't see myself as being able to fully, truly acknowledge my shortcomings in not knowing, right? Because if someone were to come to my office after experiencing something like this, losing a child to this, how can I help them? And I couldn't answer that question. And I had to tell myself, Sagan, sometimes the answer is in the question. What kind of questions are we asking? I said, okay, start by asking more questions. I saw videos where press conferences have been stopped with, what are you doing? How are we tackling this? Who is going to train our police? Who is going to properly train us? Who is going to step in and advocate for families? Who's going to be a parental mental health advocate for families? When they see a child at school that's emotionally disturbed, are we going to step in? These are questions, right? That honestly sometimes don't require answers. They require action. So I think the thing I'm not looking for, that I am looking for today, is just a call I'm going to have to answer after I'm charging myself to be the who instead of the why. Maybe it's me that need to teach parents to properly assess their children in such a way, or after they've a person that has taken their life to suicide, how do you repair a family and not allow them to fault themselves? Because that's immediately our response. Somebody's at fault for someone taking their lives, versus, hey, maybe it was their decision and choice to do that. All they see is dying at the time. They believe the pain will be gone if they're gone. Okay. Proper education is always a great response for me, but I would really love to hear the Q&A when it comes to, is therapy going to be preventative care for mental health? Are we now going to go to therapy when nothing's wrong, right? Just as we go to a doctor to check our A1C to just make sure it's right, right? That's preventative care. I can be in pristine health and still go to the doctor. So I've said all that to say thank you. My question today and my teachings come from more of a place of longing for answers. I can give you all I can as far as tips and tricks. I can talk all day and speak to that. Mine is coming at, or are we going to do as professionals on this call? Most of us are professionals on this call. How are we charged? And of course, we're responsible now for these lives that have been lost. And then what are we the answer to these questions nowadays? So I'm leaving you all with that question tonight. And hopefully I've been transparent enough to say, hey, I'm here. And I think that's the only answer I can give you this evening.
Thank you so much, Ms. Williams. I had one comment in the chat as well. We had a good bit of comments basically saying we don't have all the answers, as you mentioned earlier, but we do have one comment that mentions, but can we really say that somebody who's just quiet has a problem? Did he show other signs? Even if one shows signs, how many are paying attention to realize that this is a possible issue versus the saying of, oh, he or she is just being a teenager? Any feedback on that, Mrs. Williams?
Absolutely. I don't think at this point, we got to be hyper vigilant in knowing that something is saying like, oh, that's just teenage, is being a little dismissive. What I've learned is that you got to take everything for what it is. If you're going to dismiss all of it, dismiss all of it. But if they're being quiet wasn't the only thing, withdrawal wasn't the only thing. He had made threats prior. So were those threats acted upon? How was the response to the threats? Did we push it to the side? Did the school report it? What steps and actions are we taking out? And a result of what consequences are given for a student giving threats like that, providing threats like that? And I think that's more of a question versus, again, an answer that I can give. There are signs that are there. And as a matter of fact, I stopped myself from watching the full series of, if anyone has heard of 13 Reasons Why. And she, before taking her life, creates this audio of all the things and times that was recorded in her mind, as well as what other people had contributed to her death, right? And then it was in retrospect where they saw like, wow, she was, in need. The question more so is it anyone's fault? Absolutely not. but can we simply dismiss all or be hyper vigilant in everything we see? And I'm starting to think that's exactly, the hypervigilancy might be the answer, because is there a consequence given to students that provide threats at school? Like, what is the call of, or even home? If my child is saying that he or she wants to end their life, what do I do from that point on? Sometimes sets the tone for if they're going to repeat it. And I'm sure if anyone has worked in mental health inpatient, we see repeat offenders, because it's almost as if they come in and out of the hospital with a threat and then so on and so forth. And I also think that perpetuates the doubt in that we're doing something or helping in some way. So again, the answer is, should we just pay attention to everything? We have to at this point in time, because clearly without action, there's nothing.
Thank you so much again, Mrs. Williams. And now we will begin with our next speaker, which is Mrs. Keilah Baker Ford, which is also one of our elite members as well. So Mrs. Keilah started her nursing journey by receiving her Associates of Nursing degree in 2006, and then going on to receiving her Bachelor of Science in Nursing in 2009 from Alcorn State University. She then continued to further her education and received her Master's of Science in Nursing as a family nurse practitioner in 2014, also from Alcorn State University. She decided to continue her education and received a postmaster's in psychiatric mental health as a nurse practitioner, dually certified, in 2018 from Midwestern State University, located in Wichita Falls. She's currently enrolled at Wilmington University in Newcastle, Delaware, pursuing her doctorate in nursing practice degree. During her nurse practitioner career, she's worked with all age groups, ranging from children as young as 5 years of age, all the way to the geriatric population. She has a plethora of experience working in multiple areas of nursing throughout her RN career as well. Her motto is she believes in the balance of spiritual, mental, physical, and emotional well-being, and go above and beyond by making sure that everything's aligned with her treatment approach. She's a motivator, educator, and advocate to patients, and take much pride in doing such in her roles. Health is wealth, and it starts with a healthy state. I present to you Mrs. Keilah Baker Ford.
Hello, how are you guys today?
Good.
Good. Pretty good. Well, okay, just my end of the day did start it ended pretty rough. I did actually have a patient at the end of the day that was suicidal, and met with the parents and tried to make a decision whether I should send the patient inpatient to the hospital. It was a teenager. So just seeing teenagers having these thoughts of wanting to hurt themselves, kids, it's really sad. And like Ms. Williams said, earlier, we don't know all the answers, but we have to ask ourselves, like, are we doing what it takes? Are we assessing our patients more? Are we educating our family members about the signs, what we see, if something is off? Are we in denial about it, or are we actually trying to take action and try to help a family member or a friend of anybody that we see that's in need? And I just kind of look at demographics, and a lot of the time in the minority populations, a lot of our minority races, I don't know if it's like lack of awareness or acceptance, or the stigma that if I take medication or if I talk to somebody, I'm crazy. And that's the thing that we have to educate and let people know. When your brain is a part of your body, and when your brain is off, it affects your whole body. You have neurotransmitters in the brain. I preach this all the time. They can be imbalanced. When your dopamine is off, when your serotonin is off, when your norepinephrine is off, when things happen, when you're in stressful situations, Sometimes it could be family genetics. You can't control the things that are happening in your thought process, especially if you have that imbalance in the brain. And I have a lot of the times when patients say, well, I can control this. I don't have to take medicine. All I have to do is just do this, and I have to just do that. But if you have an imbalance, that means that brain is lacking something. So we have to educate our patients on that. I wish it was that simple. And I tell this speech all the time where I can open up the person's brain, get some serotonin, pour it in there, get some dopamine, pour it in there, boom, and that's it. But it's not that simple. Just like you might have a vitamin deficiency, just like your thyroid might malfunction, just like your blood pressure might be off, just like your blood sugars might go out of whack. Why do people treat the brain like it's different, like it's not an organ, that it's not a part of the body? And then those are my questions that I have. Why do I see more of our minority, our Blacks, our Latinos taking their lives or taking other people's lives? Because that boy that shot those kids, that's a mental illness that he had. That's with the guarded behavior, the bizarre behaviors, isolating himself. And I'm sure this is something that he's been doing. But did anyone say something's not right, or did they ignore it? And so we see this a lot in our minority populations. We see this a lot, and we have to do better with screening. I wish we had all the answers, but we can try our best to research. When we see someone, encourage them. Okay, you have to take care of your brain. I always tell patients, when it's, if you have to take something, you have to take something. If you're doing therapy, that's great, but they kind of go hand in hand. They're a puzzle piece. You can't receive the information in therapy if your neurotransmitters are all over the place. You need your neurotransmitters and their chemicals to kind of mind and calm down and be more in balance, so you can receive the strategies, you can receive the psychotherapies and all the other things and coping skills and strategies they need to survive and to make it and to process and to be the best you can be. So that's my thing. I just would love to, I can just talk about this. I'm so passionate about it. It's just so sad to me that we don't have all the answers, but we have to do more.
Thank you, Mrs. Ford. I'm going to go over some of the comments that was presented in the chat as well. Definitely from two different guests, they did mention that this current generation, of course, is not built the same like we were or anyone older than us. Basically, the teachings at home and just those conversations are not being held. Another comment was, remember from a cultural standpoint, many Hispanic families do not discuss those life issues. This is where the older generation has yet to make changes. And someone else commented, they do agree, many families of color, especially Latinos. Any piggyback comments from you, Mrs. Ford?
Yes, and to kind of go back to history, these conversations, they are happening more because there's more going on. But mental illness was a thing a long time ago. But even you see some of the elderly population, how they're suffering, how they have all these physical problems because it was never addressed. So when I say, when people, make comments about that, it's just kind of hard to me because these things have been going on. They just affected that population in different ways. Because anytime your blood pressure is up, your blood sugar is up, cortisol levels are high. So, that can also affect health. And so that's a lot of the times that's just, these conversations been going on for years. The African-American communities, Latino community, it's always been trauma there. It's trauma in every generation, but it's been there. It's just that now awareness is more prominent and now people are talking about it more. But we have to take the initiative to really get the awareness and get people talking about it, engaging in these conversations more. And then another example, I had a Hispanic patient not that long ago, as a teenager, and finally got this patient stabilized because she was in and out of the hospital. She tried to kill herself on 2 different occasions, one by overdose, and then one, like she tried to run in front of a car or something like that. Finally got her and also she was having auditory hallucinations, voices telling her to kill her family. And she was feeling like a bad person because she didn't know, why am I having these thoughts? I'm an awful person. I got her stabilized. But then I got really irritated, and I guess I shouldn't, but her father had the nerve to ask me, well, how long she's gonna have to keep shoving those medications down her throat. And I'm just like, oh my gosh, this girl just said a couple months ago, voices was telling her to kill you guys. And and she's not hearing them anymore. So it gotta be more awareness, especially in those minority, communities.
Okay, thank you, Mrs. Ford. Also, we did have a comment from our president. In nursing, we are taught to address things holistically,
Yes.
talk about the spiritual component. Okay, so we do have a few hands up. First, we will go with Ms. Dr. Latricia Harrison.
So I was going to bring in the piece, I agree with what the presenters are saying, and thank you all for your presentation. One of the things that I've seen, surely with my particular patients, and I've had, to what Keilah was saying, I've had a patient, a little 15-year-old guy came in, Hispanic, about 2 weeks ago, begging for help because he was suicidal and he had attempted suicide twice. And he said he didn't understand why he was not successful in his attempt to commit suicide. And it just, broke my heart. And I immediately sent him to the hospital, to try and get him some help. But, you all were saying, we were saying about mental illness has been around, it's biblical. I mean, Paul in the Bible had, anxiety and depression. So you're right, this is not anything that's new. But culturally speaking, when you're looking at your Black and Brown communities, yes, we've had it here, but it's always been the uncle in the room with the closed door. We didn't talk about it. We didn't address it. And even today, even with your younger people or your older people, the thing is, oh, I'm going to pray about it. Listen, I tell my patients all the time, God is my savior. I mean, he's my all. I believe in Jesus Christ. I believe in the death, burial, and the resurrection, but I also believe that God prepared people to help you here while you're on earth. And if it was in the Bible and it was addressed, then, it's 613 scriptures on anxiety and fear. So we know that it's real. So don't negate, what you're going to pray about, because God can heal and he's a healer about the diseases, but also he made medicine. So you might need a pill. You might need a pill also. So, just trying to maneuver and break down some of those barriers, because it is still a stigma within our communities where we as providers would feel like, this is okay, let's talk about it. But if you have people in the church, because you have a lot of church people that believe that mental illness is a sin, and they're not addressing it, they're not talking about it. So this is a topic that has to be so many barriers that have to be broken down and maneuvered so that we can give people the help that they need. And also, just talking about grief and how those feelings of grief are leading into anxiety and depression, because we're never taught how to grieve. So when you lose Big Mama at an early age and you go back to school on Monday because you buried her on Saturday, you went to church on Sunday, you went to school to work on Monday, nobody talks to you about it takes 9 months to a year before your mind realizes that Big Mama's not going to come through the door. So then that starts to translate into a lot of the other emotions that you see people struggling with. And my last point is that, even with the things that was placed in the chat, this generation, they don't have any coping skills. You know, we have been parents, I won't say what I say with my siblings, but we have been parents who have been helicopter parents, you know, so we've kept them from, you know, failing, or we put them on the teams where they got a participation trophy, and we didn't teach them how to cope with failure or disappointment. So their outlet is, nobody loves me, so I want to be here. So I think that those are the conversations that we have to start having and trying to bring people in and get into the pastors and the providers, you know, and the families, just to start making these changes.
Thank you, Dr. Harrison. We have Mr. Chester McCoy. You can go ahead.
All right, thank you. I want to thank the Black Nurse Practitioners Association for having a clinical social worker join your chat tonight. I'm enjoying this. I'm learning a lot. I wanted to address, just make a couple of comments about one being the epigeneity of trauma, particularly in the African-American community and Latino communities and communities of color, that it becomes something that becomes somewhat like a part of our DNA, that because of the trauma that our ancestors experienced, especially as a part of the transatlantic slave trade and being enslaved and having to live through Jim Crow and seeing lynchings and all of this stuff, you know, it plays havoc on a person's mind. And it, you know, I'm a pretty optimistic person, but I'm telling you, I'm balls every day. The other thing I wanted to say about the stigma is, over the years that I've been practicing for almost 50 years as a social worker, I have seen people who have the dual diagnosis of chemical dependency and mental illness. And you know what? They will say, I'd rather have this chemical dependency diagnosis, because if I got a mental health diagnosis, people don't say I'm crazy, and I can't get rid of that. But I could quit drinking or quit using drugs anytime I want to. So they would trade one for the other. And that just makes me more acutely aware of how stigmatized people are about that. And I agree with many of the comments and suggestions that people are making. Again, thanks for having me tonight.
Thank you, Mr. McCoy. We have Mr. Travis Holmes.
Evening. How's everybody? Thank you for inviting me to sit here and listen to you guys. I am not in the medical field. I am a former chaplain assistant of the U.S. military. So I've dealt with the behavioral health, the mental attacks, the suicides, and everything. But what I want to ask a lot of you is, have you ever considered, as far as increasing knowledge with dealing with suicides, have you ever thought about reaching out
Crystal,
to maybe
you bald as shit.
military chaplains? Because us in the military have dealt with many different types of suicides, many different calls late at night. And not saying that you guys aren't doing anything well, but maybe there may be something that words of support that a chaplain could possibly provide.
So I think that as a chaplain, coming in and, and I think that even Keilah or Sagan, if you want to respond too, I think that as a chaplain, coming from the spiritual piece of it and, addressing that issue, but also, having resources for the patients or the people that you're coming in contact with, because a lot of times we're not aware of those resources. And I think that we have to be more vigilant in providing resources so that people can get the services that they need.
Yeah, I would say the same, like the resources, but more like finding out where these crisis hotlines are, or directing patients or directing, those clients to resources or someone they can call to talk to them or see what they need or get them the help that they need. because they do have a lot of crisis hotlines out there for patients to call. But a lot of the times, like you're saying, people don't know that it's different things that they can do or utilize.
I also like to add to that. I think as a chaplain, I'm just speaking for myself because I have a pastor that is like merged between generations, where he is more open-minded and susceptible to getting credentials, right? He's more of like, I'm going to go get these CEs that could better my youth group, or I need to better understand the type of terminology they use. I need to see what social media has an effect on the people in my church. So he has a desire to reach the generation by, of course, going to, this is open. I mean, of course, not all CEs are free, but he is investing in his congregation. And that's the way I feel. I also feel like he's a more open pastor, although, he is, who he is. I think he just has the knack of wanting to learn more. And I think as a chaplain, you can reach a lot more people if they see that you're open to maybe life coaches coming to speak to your youth groups or a cell group, or maybe even being open to have a prayer call strictly about mental health, allowing therapy to be a focus for the month. So he just, again, merged the fact that, hey, yes, you do need scripture. You do need the word, but you also have to do the work. So he's just able to merge and bridge that gap for us. And I think as a chaplain, you can reach far more people than we could.
No, I agree with everything that you guys are saying. I've just, between Iraq and Afghanistan, I've seen a lot, So and I've had many soldiers come into my office with different things. So it's always been the idea to mainly meet them where they are and build them up if they need it. And when it becomes more so out of my hands, I have to turn it over. I gotta, if I need to take it to the hospital, I have to take it to the hospital, because that's outside of my expertise, and I have no problem saying that.
Thank you for the work you do, Mr. Holmes.
Thank you, Mr. Holmes. Thank you so much. Next we have Ms. Lauren Dunn.
Hello, I am a psychiatric nurse practitioner at a multi-specialty clinic in Acres Home. And so one of the things I've noticed is that representation matters. When I get my clients in and they see that I look like them and that I can understand some of the things that they've gone through, it helps them to trust the process, to trust the treatment plan, that someone is actually there in their corner. And being in the community of Acres Home, I get some of everybody. I've been in mental health for 10 years, from inpatient at HCPC to now at this clinic. And it's all about the trusting factor. So to get rid of that stigma, we have to show them that they can trust the healthcare system, because you got to go all the way back to the Tuskegee experiment. Yeah. There is a distrust. And then they have the spiritual aspect of it is, oh, we're going to pray about it, or we gonna give it to God, and we do. And I tell my people, I love the Lord, but then I started showing them in the Bible where you had people like Elijah, who was depressed and he was about to give up and was going to commit suicide. You have David, who's in this cave when all these people are trying to attack him, and he's like, I got to give it up. And so I tell him it's a combination. I always say, yes, this medicine is going to help you. We don't look at Big Mama crazy when she take her hypertension medicine, but she put them salt on them greens. We don't look at this person crazy when they still eating candy. I say it comes together. So we have to have representation. It has to be more people that look like us that are promoting mental health to get them to come. So that's my take on it. Also, my pastor has started to use his platform to do sermons called Help Me Before I Hurt Myself. And so basically his sermon series for the whole summer has been on different mental health issues. He even stepped on the platform to let people know how he suffers from anxiety. So when you see your leader standing there in the community, showing how important it is and saying, I'm not no expert, but this is what I'm saying, I take medicine and things like that, it draws. So people, we have to stand up and show that people of our color, we understand mental health.
Thank you, Ms. Dunn. And next we have Dr. Stephanie Brown Elder, one of our board members.
Good evening. First of all, I just wanted to apologize, guys. We did have a couple of hackers that came on, so please excuse that. They have been removed from the Zoom meeting. And then also, this is such a wonderful and very needed, candid conversation. Some of the things that I think about, they have already been touched on, but first of all, are the signs. I forgot how Latricia made a reference to it, but when I was coming up in my time, and a lot of you guys here came up in my time, we were referred to as the latchkey kids because parents were constantly going in and going out and going to work. And so, you know, you were taught, you get home before I do, you open the door, you're going to home, you stay there, you do what you need to do, wash the dishes, wash the clothes, start your homework, and move on about your life. In this day and time, things are so different. And what I mean by that, so back then we had TV and you had a book and that was it. Now you could actually have a home with your kids and not even have one single TV in the house because they're always on, whatever the case, all of the social channels. And a lot of times they are exposed to things on the social channel that can help feed into their mental health. So when you have the parents who are not there providing that one-on-one after school, letting them know, hey, how did your day go? How are you feeling about school? How are you feeling about your grades? But they're all on social media seeing someone saying, you know, well, I didn't make a good grade today in school. So, you know, bad word to my teacher. I'm maybe wishing my teacher was dead, or I had an issue today at school, but now I'm going to post the actual fight all over social media. So what that now does is it feeds into all of these young minds who don't have a lot of direction, and they start to feel like this is the right thing to do. So that was my first point. Just in what can we do, what more can we do as healthcare providers to ensure our parents, and I'm not saying parents don't pay attention, I'm a parent. I've been to work today. I came in from work, I grabbed something to eat. I spoke to my 16-year-old, I asked her how her day was, and now I'm on this meeting. It's gonna be well after 8 when I get off. But I know that I need to reroute and I need to go back and finish that conversation, and a lot of parents are not doing that. The second thing someone just mentioned, Lauren Dunn, bless your heart, I need all of your information because I'm very close to where you are providing care. But in terms of cultural sensitivity, she is so on point on that because I receive individuals in my clinic all the time. And I may have seen them 2 or 3 times and I'm getting so much information out of them. And then a lot of the times I'm asking, had you not informed your prior provider? You're telling me you've been suffering from this and thinking this way in the past 3 years, and you have this prior provider, did you not tell them? And what they will say is that I didn't feel comfortable. So I think in addition to just the approach of a provider, is cultural sensitivity. They need to understand and know that we understand and can meet them where they are. And a lot of times that plays a significant issue because there's no cultural competence with the providers who are out there. Last thing, I don't remember all these statistics right off, but they've been on the news for the past 48 hours. So I think they're saying that Texas is ranking one of the last states in America with the number or the access to mental health. But yet and still, we are leading America with the number of incidences that we have had to occur in the past 5 to 10 years. So what does that say? It says that we probably need to get together collectively as a group of providers to help increase mental health awareness in our communities. And that is exactly why I am so thankful that my organization and all of you guys have felt the need to come on and give your time so that we can help inform each other. And thus we can decrease the number of people, hopefully, who are committing suicide and mass murders.
Thank you, Dr. Stephanie. Did anyone else care to piggyback on any of the comments made thus far?
You know me, I always have something to say. I am going to just piggyback off of what Dr. Brown Elder said. I mean, because it's so imperative that we bring this information to the forefront and have these discussions, even amongst our own family members, you know, because a lot of times we're talking with our patients and we're seeing it. And it's so disheartening to see so many young people coming in crying, can't sleep, they're depressed, they are anxious, they can't figure out how to manage their daily routine, you know, handling babies and working, you know, whatever life is thrown at them. So I think that one of the things as providers is, you know, I encourage parents to make sure that they take away the cell phone, take away the video games, you know, limit the screen time, you know, talk to their babies and, you know, and just encourage them, because a lot of times, not only are the parents on the telephone, but then they're giving the kids the phone, the parents are doing the same thing, you know, and they're not engaging and not paying attention to their babies. But also, as someone said earlier, you know, about the medication, listen, I tell my patients when I'm asked these questions, if you have a headache, you take Tylenol, right? Well, yes, I take Tylenol. Well, then you take this pill, you know? So I mean, it's the same thing. You have a disorder right now. You're not walking into a room saying, hi, my name is anxiety. You know, my name is depression. You're
Right.
walking in and introducing yourself. So I think that as we continue to have these type of forums and conversations and taking them to the church and taking them to the schools, you know, because as someone said earlier, being able to recognize the signs of depression, because sometimes the patients don't even know that they're depressed. You know, they think that they're okay. I had the young man in the office and he just had such a flat affect. And I was like, you know, are you okay? And he just came in for a general checkup and he was like, I think so. You know, and I'm like, but you look like you're depressed. And he was like, well, my mom says that all the time. I'm like, well, maybe it's true. You know, so
Right.
now I'm digging and trying to pull. So I think that even as us as providers, you know, I know our time is limited when we go in the room to see our patients. However, I think it's so important that we pull those conversations from them and make it okay. And I constantly reassure my patients, it's okay to not be okay. You know, because a lot of times we are in the closet or in the corner rocking and blowing spit bubbles, and then we watch our face and get up and go and act like we're all together, and we're not. You know, so just being okay, we're not being okay. So I did want to put that information out there. And, you know, I think that we just have to continue to have these type of forums and just bringing this information to the forefront and letting people know it's okay to talk about mental illness. I don't think you're crazy. I just think you need some counseling.
Correct. Also, too, we discussed in regard to the shooter of the elementary school, just some of the characteristics that he presented was that, oh, he's quiet, he was withdrawn, but we need to be aware as well. You can have a person that doesn't show any signs and show that they have it all together. Basically, you know, just high and bubbly and all of that. If you all can go back to January earlier this year, high profile suicides, such as the former Miss USA, Chelsea Christ. You see Chelsea, gorgeous, attorney, Miss USA, African-American, bubbly, have it all together. But Chelsea had been dealing with depression for a long time, had attempted suicide back in her early 20s as well. And if you've seen recently, there was a red table talk conversation with her mother. It was the first time she addressed the suicide since it happened, and basically stated that after the first suicide attempt, she did reach out. She did all the right things. She went to counseling, was, I think, maybe prescribed some medication as well. But despite all her accomplishments and everything throughout the years, still wearing and tearing on and just being in the spotlight, the depression became more pronounced and ultimately into her life earlier this year. So looking at that, that's a prime example of someone that you would never think, because she has it all together and has that look and that persona of what young Black girls want to be, but ultimately was dying inside and dealing with her own demons. So one thing to take back tonight is the person that looks like they have it all together, whether it's a friend, a family member, you constantly, you check on them too. You don't just assume everything is okay. They're not feeling depressed, you check on them as well.
That's a great point, Crystal. I was actually just thinking about her. So one of the things, and I'm pretty sure all of the practitioners and providers online are aware of this, but a lot of the times when individuals are coming in, they may not feel too comfortable talking, but at least once a year on their annual, you guys are, we are giving out these depression screenings. And a lot of times I have found an individual who may look like, sound like, be like the person you just referenced. And then when I'm looking at that depression screening, once I'm getting into the room, it's like, oh my God, your score is 30 over here, you know, let's talk about it. So I definitely agree, looks can definitely be deceiving. And sometimes you can get that person to actually put it on paper, and it kind of leads and guides you a little bit more where to start. Let's talk about this. You're not sleeping, you're not eating, especially for the person like Dr. Harrison said, oh, I'm not depressed. My mom says it. But if probably when she went down that list, she saw he was not eating, he was sleeping less, or he's overeating. So that makes a big difference too.
Okay, and I'm just reviewing if anyone had additional comments in the chat while we were talking. We did have one comment. It mentioned, when is it too much? When is it time to just take a breather, decompress, and then come back to your work? Anybody would like to comment?
Yeah, productivity is the first sign of workplace fatigue for sure, and workplace, like just compassion fatigue, so to speak. So if you're working in a field, a helping profession, you're going to see your productivity, things that you're going to forget. Your schedule is falling apart. If you're starting to forget the keys and things like that, I know that might seem simplistic to you, but if that's not of your norm and you're a more organized person and you seem to perform very well at work, productivity shows first, typically, because you're tired, you're stressed, and your mind is occupied and not on work. So I would definitely say pay attention to that. You need to use your PTO. If you have, and if you're one of those persons that are just kind of got accustomed to this pandemic, work from home, and your PTO is still needed, then hopefully, you know, that might not be you, Mr. Holmes, but the productivity and those signs at work is definitely checking with your coworkers as well. Don't be too prideful to ask them if you're acting differently. You may be a little bit more snappy. If you govern or supervise staff, they're quick to tell you that as well. So I definitely, and there is another one, Dr. Thibodeau, in the chat. Dr. Harrison put something about the shooting as well.
Let's see. Okay, so Dr. Harrison mentioned, so what do we tell the babies who may be afraid to return to school since the shooting?
And the only thing I can say is what I've been doing. I've internalized a lot of these questions because that's all I can do at this point. Safety planning for me and explaining to my children that there are things that we can't explain and why people do things that they do, we don't know the answers to, but to remain safe, be cautious of your surroundings. There are some book sacks that they've been selling, honestly been broadcasting since Sandy Hook, with like a safety sack. They're bulletproof, and I know that's probably they've been donated to schools since the Obama administration, but there's some safety sacks for kids that have little things in there where they can hide, little guides and maps in there. They can get behind desks, get in closets, stay away from, you know, certain doors, don't go in a place without a window. The same thing you would do for tornadoes, hurricanes, and things of that nature is the same way we should be planning. And I know this probably sounds horrible to even say, especially for me to even say it out of my mouth, that we have to plan for this. But we have to have a plan in place for this. It's just the way of the land at this point.
Thank you, Mrs. Williams. Keilah?
Well, I just kind of wanted to piggyback on what Ms. Williams was saying. That, to me, that is such a very difficult conversation to have with little children. Like, I don't know, how do you prepare your 7, 8, 9-year-old for something like that, or even think that you're going to send them to school and never see them, or they can be hurt or harmed in that way. So I don't know. For me, it's just kind of hard to even, to even try to prepare or have that conversation with my child. And that's just kind of off of the mental health away from the provider standpoint. Because when in a situation like that, if you're a parent, it's just kind of hard to put yourself in that provider role. So I don't know.
And we did have one more, thank you, Keilah. We had one more comment, muscle memory training, easier said than done, but we have to have the conversation about security, practice safety drills. Unfortunately, it does not have to be the new normal.
Yeah.
There's also a comment on Facebook Live too, Crystal, where
Okay.
Carol Williams is saying, we must normalize mental health care just as we normalize physical health care with our patients as well. So.
Absolutely.
Correct.
And I'm agreeing with
Basically-
Keilah as well. I'm sorry, Dr. Thibodeau. I was agreeing with
That's okay.
Keilah as well, because having the conversation, I've cried through it. I have a 4-year-old, I have a 10-year-old, and I have a 2-year-old. I haven't talked to the 2-year-old, as you can imagine, but my 4-year-old is very equipped. She's going to be 5. I've cried through it. And I think just as hard as these conversations are the same way people feel about mental health sometimes. They'd rather just ignore it. But we got to get comfortable having the uncomfortable conversation. Cry through it. Let them see that you're vulnerable as well. Let us see that it matters to you. They're going to ask mama, why you crying? And you can explain to them that it hurts. And I don't understand why people are this way and why people are mean in their language, of course, to better reach them. People are mean, baby. I don't know why they do this, but we just know we want you safe. And if you see somebody, you run and and those things. And I unfortunately cry through it, but have it.
Agreed. And basically you took the words out of my mouth, Sagan, when I was about to say, basically we need to get comfortable having these uncomfortable conversations. And basically when talking to someone, not doing it in a judgmental manner also. So being an open book and being understanding and empathetic at the same time. Anyone else cares to share any additional comments?
Can I just say, and I saw Madam President over here. I saw you, Mr. I want to say 2 things, because I saw y'all are making up the 4% of the Black clinicians that we have in this country. Notice I said 4, not 4T, 4% of Black clinicians in this country that are servicing people within just healthcare, period, mental health specifically. What Mr. and I think it was McCoy had mentioned as well, the way before, when my mom and her mom were growing up, silence was survival. Okay, you could not speak because you knew that something was going to occur. As a result of that, you get a generation that is uncertain of when to talk and then how much to divulge and pretty much give out. And so we're all a result and a byproduct of a traumatic history. And I just love the conversations on this call, but this is actually, honestly, the step to resolving a lot of this is what you all put up, a forum like this.
I just wanted to add, I just wanted to add, with working with our veterans, because there's such a high suicide rate when you look at veterans and non-veterans, the men versus the women. We have to have a plan, right? We have a crisis plan, right? We have support systems for them, and we have a contract. So those things that, although they're uncomfortable, we have to ask serious questions. As Stephanie brought out, we have to do this, the tools, the PHQ-2, the 9, and if we need to go on to the other scale. But these are things that we have to do. Not necessarily, not to say that this is a new normal, but it's a way to prepare ourselves, to prepare our children, give them coping skills.
Thank you, Madam President. Anyone else has any comments?
I'll just be brief. And this is coming from a security standpoint. I understand that for many of you, it is a very tough conversation to have with the kids about what to do if an active shooter comes to the school or whatnot. I do encourage you to have your own little drills at home, and encourage them to be silent when they go into hiding. Do not make a sound. If they have a cell phone or whatnot, remember to keep your phone on silent, or the same muscle memory that they develop while playing a game is the same muscle memory that they can develop in those drills. Not saying that it would be easy, but it's something that has to be done in this day and age, unfortunately.
That's very good information. Thank you for that. As simple as that may seem, and I haven't recently talked to my 16-year-old about it, but I am definitely going to revisit that conversation tonight. She's old enough to know that. But in the midst of a situation as that occurred on yesterday, you know, you may not immediately think that is the thing you need to do. So thank you so much for that information. I'm gonna make sure I review that with her and a couple others. Very good information.
That's really good information. I know one of the men whose daughter was killed on yesterday said that his daughter was actually trying to make the call when she was killed. And that just, and you know, he was so distraught because I guess they had done these things with their children, and she was trying to make the call, and as the call was trying to go through, the person took her life. You know, so it's just, it's very tragic, but I like those points, you know, that you gave. Those are really important points. And, you know, we have to talk about safety, and even just in safety in general, you know, so it's so many layers of the conversation I think they have to take place in order for us to really start making an impact, you know, and not to be political, but to be political. We have to make changes, and we have to, you know, get out and educate our people on what's important and who you are voting for and putting into positions of power, because that matters. And we have to be involved, and we have to stop thinking that my vote doesn't matter, because when you don't vote, it doesn't matter. But we have to be educated, and we have to be informed on what are the rules, what are the policies, what does this person stand for, you know, and be involved and be informed as a citizen, so we can stop the NRA from having a whole conference in our city and, you know, promoting guns and weapons. And I'm married to the police. Listen, and so I'm used to law enforcement and guns, and, you know, we have different views on a lot of things, but this is something that we have to really take a stance on as we are trying to make these changes, because as Beto said on yesterday, if you have an 18-year-old buying an AR-15, and that's a huge gun, what is it for them to do? You know, but to kill somebody. And then as my husband, who's a police officer, his stance is, as police officers, they are not equipped to fight the bad people because they don't have the same weapons to match them. You know, so the police officers are not walking around with AR-15. So when they talk about the police are delayed in going in and taking the person out on yesterday, unfortunately, they have policies and protocols that prevent them from just rushing in, because they may not go home to their families. And then that's a different conversation. So again, it's so many layers, but we truly have to really be informed and aware, because in Texas, if we're at the bottom of the totem pole as it relates to mental health issues and access to mental health care, then that is a huge problem, because as much as we talk about it, if we don't have anybody to treat our patients, I see Medicaid patients, it takes them 3 months to get into a provider's office to be seen, and that's quickly. So 3-6 months waiting periods. I'm telling parents right now, start getting your appointment for August so that you can get in to get your child's medication so they can start school. And we have to educate the educators. So when they're writing these kids up, we can stop that pipeline to prison when they are diagnosing these kids and calling them bad and, you know, labeling them as bipolar, and they may not be bipolar, you know, so, and we use that term so loosely. We have to get, you know, just, and make some changes. And it starts with us being informed, doing what we're doing, having these discussions, and taking it on the road per se, you know, to the churches, to the schools, to the community, so that people can start being okay with talking about the things that need to be talked about, but also informing them on what's on the ballot, what's coming up in November, and how you need to make some changes so that your voices can be heard and you can have some access to healthcare that's affordable. That is my soapbox. I'm going to sit down.
Thank you so much, Dr. Harrison. Dr. Steph?
I was just telling her that was an absolute good soapbox. Agree. I cannot agree with her even more. Even outside of the NRA, just like she said, us banding together to make sure that we are voting the right people in the right position who stands for the people. And again, not to make this political, and you can read it for yourself, but go out and read the amount of campaign contributions to some of our legislatures locally. And I'll just leave that at that. Real quick, Crystal, just to ensure that we have not missed anyone, I know that there are maybe a couple of other providers on the line. You are more than welcome if you have a comment or want to share a story with us this afternoon before we end our talk.
Absolutely. I don't see any hands up per se, but definitely if someone would like to speak, you may do so at this time. Going once.
I'm kind of like Dr. Harrison, Dr. Tippy. I'm gonna take it. I would like to say, okay, let me just say this, and then I can hush my mouth. Social media. Okay, I know we had a few doctors on the call, Dr. Elder, Dr. Harrison, y'all mentioned there is a pitfall to social media, right? But it is advantageous, as we saw via COVID, right? We wouldn't even have this had not Zoom had its advancements. So I think reaching a larger audience and a younger audience is going to require social media, because a lot of us, including myself, live with our heads down. If I see something on social media first, honestly, I'm going to be more inclined to go seek services, or maybe such and such Taraji P is putting on something about mental health, and I saw that. But it reaches a larger audience, and it gets to them a lot faster if they're able to see more in the people that they actually align with, celebrities and so on, promoting a healthier habit of seeing a physician or a psychiatrist or a licensed counselor, so to speak. So it's just it's a yin and a yang. I say social media, I would leverage it. That's just me though. I think leveraging social media, and if you're a person that's a provider of mental health, finding a way to get in touch with a younger audience that way as well. So it's a blessing and a curse, I guess I would say.
Oh, I want to add, and I'm all about meeting these kids or meeting the youth where they are. And it's all about your approach. I have more of the teenage and younger adult populations, majority of my patients, but, you know, I just feel like your approach matters. So, you know, instead of, you know, a lot of the times I get patients and they be nervous about the visit because they feel like, oh, you know, they kind of looking at like, this person's just, they're all strict and they're going to put me on all this medication. They're going to think this. And then once they kind of start talking, they be like, this was really, you know, yeah, I'm just all about meeting people where they are, you know, building those relationships, building their trust. And then, you know, If they're not ready, don't be pushy, but just kind of meet them where they are. Because at the end of the day, once they start to trust you and see, they'll take what you're saying into consideration, and they will take the steps to
Open up.
take care of themselves and open up, or, you know, take those resources and everything that you suggest.
Thank you, Keilah. Do we have anyone else before we end the session?
I just want to go over the ones, the comments in Facebook Live. Angela said, very important conversation. She agreed with something that was being said. Ms. Heflin said, so true, it's not just voting at the presidential elections, but also at the state levels. And also Ms. Davis said that reaching a younger generation will require social media. She said, well stated, Sagan. She agreed this is powerful.
Good. Thank you, Dr. Harrison. Well, this will conclude our mental health awareness session for tonight. We appreciate all of you for joining this evening and taking time out of your Thursday evening to have this very important conversation. And you all have a great night. Thank you so much.
All right, thanks. Thank you so much.